This is Jerry Hesch of the Hesch Institute in Aurora, Colorado. And this is my client Betty, who sees me about once a year when she comes out from Midwest. And picking up her granddaughter in August caused her to develop left-sided pain, and she's tender over the region of the left SI, especially over the PSIS. Has seen a chiropractor and no benefit from that. What I find is that she has full hip extension passively on the left side. And interestingly, on the right side, just relax and try and let me do the lifting. You're having a hard time relaxing. Okay, so she's only got 5 degrees of hip extension on the right side. And that'll be pretty straightforward to treat. She has good mobility throughout the pelvis on both sides. And so I'm just testing, rotation. And then I'm testing inferior glide. And then I'm testing superior glide. And you'll note that her sacrum, the lower sacrum, is symmetrical when she's prone. And when she's prone, I can spring the left lower quadrant of the sacrum. But when you put her in flexion, then she develops what looks like a sacral torsion, and that motion becomes blocked. So let's have you sit and face me this time. Very good. And then bend forward and lean on your hands. And so I always test people in sitting. I test the sacral mobility, and I separate the sacrum into 4 quadrants. I wrote a book chapter on this called Sacral Torsion. It's in Eric Dalton's book called Dynamic Body. And I isolate the PSIS's, okay? And then coming in, I'm now on the sacrum at S2, and I go up 1 thumb width, and that puts me at the upper sacral level. And I can thrust forward with my right thumb, and I can thrust forward with my left thumb, and we come back to S2, and then this should be S3, and then this should be the S4-5 region. And I note that this thumb is prominent now. It sticks out towards me. So if I bring my thumbs together, it overlaps it by, maybe 3/16 of an inch. And I can induce motion thrusting it forward on the right side. But when I try and thrust with the same amount of force on the left, it's not moving. Okay, so we don't have that spring mobility. Okay, and if we come underneath the sacrum, I note that my left thumb is lower. Okay, it's lower than the right thumb, and I can lift up, and this force translates through her body. And when I try and lift up on the left, motion is blocked in the SI joint on the left side. It's blocked. Okay, I can't quantify the motion with a clinical examination. It's simply impossible, but I can discern when motion is blocked. Okay, and the treatment is very straightforward. The key is to get the hip moving first. That everything's connected. Hip, relates to the pelvis, relates to the lumbar spine. I'm going to take a quick look at her lower lumbar spine, and I don't get any hint of a rotational pattern or muscle guarding there. And so I'll go ahead and demonstrate to you how I'm going to treat the hip and how she'll be able to treat it herself. So let's have you lie on your back. And what I do is a passive, long-lasting stretch. And I use this 2" by 4" by 8" foam, and it gives a little bit, okay? And it was your right hip that was lacking extension, okay? So I place this underneath her thigh, so it's below the sit bone, okay? So I just simply place it horizontally, just like that, okay? And I like to do that for 5 minutes. We can do that for just 2 minutes and come back and retest it. And then while you're allowing that passive stretch to the hip joint, I'm going to demonstrate the self-treatment for sacral torsion. I could I could mobilize that sacrum for you. But my philosophy is to make people independent and to teach them how to do it themselves. And what I do is, again, I use this foam and I place it on the lower sacrum. Okay? And then you just do forward bending with this foam against the wall. And the way that you find the lower sacrum is you come up the gluteal crease, coming upward, and then you find the tailbone, and then you just simply place it right above the tailbone, and that'll be on the lower sacrum. So then you lean against your wall. Your feet are as wide as your shoulders, and your feet are 4 to 6 inches forward of the wall, and you place the foam against your lower sacrum, lean against the wall, and then you simply bend forward slightly 10 times, 10 to 30 times. It's a great low back exercise. It's wonderful prevention, so I encourage doing this once a day. So again, I'm going to find the crease of my bum, I'm going to find the coccyx, the tailbone, and I place this across. Flat part is against the wall. My feet are as wide as my shoulders, and my feet are about 6 inches forward. And all I do is touch the wall with my shoulder blades, and then I bend forward. Could you come look at through the camera and see if there's a good view of me? And all I do is bend forward, nose in front of toes, and then I touch the wall with my shoulder blades, and I do 10 of those. Okay? Very good. So that's 2 minutes. Let's see how her hip is moving now, and then we'll have her do this wall self-treatment for the sacral torsion. Okay, can you lie on your stomach, please? And bend your knee. Okay, try and relax. Try and let me do the work. Much freer. Okay, good. So follow me to the wall. You're going to place this above the tailbone.
Okay.
You're going to lean against the wall. You know this one, don't you? No?
I think I did it maybe.
Okay, so your feet are as wide as your shoulder and your feet are 6 inches forward.
Right.
You touch the wall, and then you bend forward. Nose goes in front of toes. Do 10 of those. Very good. Yep. So just slight bending, just nose in front of toes. So what I'll have you do is do that hip stretch on the foam. Do it for 2 minutes every day for a week. And then do it once a week thereafter.
Okay.
This is a wonderful one to do every day. 10 of these every single day. Okay? So come and sit and let's see how that sacrum is moving.
Okay.
All right. So I'm coming up underneath the sacrum, and now I'm lifting up, and the force translates freely. So that's no longer blocked. I'm on the lower sacrum, and they look much more symmetrical. My fingernails are about to touch, and I can spring forward on this side, and that moves nicely. How do you feel now over this PSIS? Is there any difference in tenderness?
I don't. Maybe just a little bit.
Uh-huh. Okay, lie on your stomach. And how does it feel?
Where your left finger is, it just is a little bit tender.
Okay, so
I don't know if that's because it's been out for so long.
Okay, okay. I'm going to just do one more test with you.
Okay.
Let's have you lie on your right side. Good. And so your legs are straight. That's what we want. And I'm going to test you for, test your transverse plane mobility through the pelvis. So I'm on the front of the ilium, and I'm loading it and I'm springing it, and that has good mobility. Okay? And then I come back and find the PSIS in the posterior ilium, and I compress it, and that has good mobility. So I feel like we're off to a good start, and you know the self-treatment. And thank you for letting me post this.